they came. Before we start, I request all the participants to please go for the respective competitions which are being conducted at various venues here. All those participating in the competitions, please proceed.
Shall I? A very good morning to all of you. Yes. It's such a pleasure to be standing here and facing you all. Before I start off, let me first of all thank Dr. Sumitra for this nice words of intro, and thank Royal Dental College for having called me here, and especially Dr. Viniraj for picking me for this session. He is just a wonderful organizer, and I think he has got miles and miles to go. Maybe he should be arranging world conferences someday. The nationals are just too small for him. Well, I would just like to know, I can see a few practicing doctors here, senior doctors here, but other than that, most of you, I presume, are students of UG and PG classes, right? And anyone who doesn't understand Malayalam here, kindly raise your hand. So, no, I have a flexibility of actually maybe speaking in Malayalam too. And now we have just 30 minutes. Dr. Viniraj has been really miserly allotting me time. It is such a big topic, and the time allotted is just 30 minutes. I don't know how I'm going to manage it, but we will just have a walkthrough or maybe a run through the topic and see what he gains out of it. The topic actually is medical legal challenges in dentistry and its solutions. But my challenge actually is to concise it to 30 minutes. I would like to first of all congratulate each and every one of you to have selected dentistry as your profession. It is indeed a very rewarding, very satisfying profession which has got a beautiful work-life balance. Very few professions have got this beautiful work-life balance. And dentistry is one. In medical profession, maybe you have dermat, you have ophthalm, and perhaps radiology, and a few specialties like that. Sooner or later, you all are going to be practicing dentists. And while you start your practice, when you start your practice, I would just like to leave you with a few points that you should always remember. Because, dear ones, the society that you see out there is no more the same as it used to be. Consider ourselves like any other profession. We don't have any extra privileges in this country. In fact, we are more vulnerable and easy targets than anyone else. Do I have to explain more? The recent incidences that took place in Kerala, which finally culminated in the death of our dear Dr. Vandana Das itself is an example for that. I was there to offer formal tributes at her home that day, and it was a very sorry, heartbreaking sight. I don't know how many of you know what CPA is, Consumer Protection Act is. Probably many of you might have heard about consumer protection, but have you ever thought that it has been associated with medical profession? Consumer protection has been brought in by the central government as an ordinance in 1986 for the protection of consumer rights. During that time, medical profession was never included in it. It was later date, after 9 years or so, that consumer protection was brought under, medical profession was brought under consumer laws. And ever since, we have been seeing a surge of cases both in the medical as well as in the dental field. And especially Kerala being such a highly litigated state, we are very much aware of our consumer rights. So we have lots of cases in Kerala that are coming up in our field. The world out there, my dear friends, is not as beautiful as it is, as I told you before. Challenges would be there and it would come up time and again in front of you. It might appear, the society may appear as a green field where you would like to walk freely, but please do remember, try to walk over it as cautious as you're walking over a field of landmines, because time and again things might pop up in your life and it might blow you out of proportion. Okay. So if you want to lead a very peaceful life, be very cautious. Saying this because I personally do want to see you standing in an acquitted box along with thieves, lawbreakers, or maybe criminals. This is what I always believe. When you see a patient, right from the first patient that you're going to see, you have to see him medico-legally first. Then you have to see him medically. And then you have to see him technically. And then comes all the doctorly instincts like sympathy, empathy, care, compassion, all that. Just get this in your head, because this should be the basis of your practice life, especially your private practice life. Now, what did I mean by saying medico-legally? Medico-legally be safe means always document your cases. If you are drawn into a court regarding a case, you go there and tell the judge, "Nan patient not angana paranju, and patient not idu paranjirunnaanu, and complications adeyathodu paranjirunnaanu." The judge is not going to hear you at all. He will ask you, where is the evidence? നമുക്ക് എല്ലാവർക്കും അറിയാം, കോടതികൾക്ക് വേണ്ടുന്നത് എവിഡൻസ് മാത്രമാണ്. Judgments are purely based on evidence. So unless and until you document the case, there is no value for that in the case, in the court. Okay. The case sheets, first case, maybe third, first case and second case, but basic. But maybe the third one from the, maybe the second one from the top and the third one from the bottom. Implied and informed consent are two things that you should be knowing. Implied consent is the consent that you take from the patient. Case sheet definitely should have both this legally. Implied consent is that type of consent which you take from the patient right after you take the vital data. It simply means the patient is willing to be examined by you and to be treated by you. Nothing more, nothing less. And after all that, after your examination, investigation, and everything, when you come to the treatment planning, you explain to the patient about the treatment. That is going to be imparted upon him, the pluses and the minuses, the advantages and the disadvantages, and then finally the charges. ഇതെല്ലാം പറഞ്ഞതിന് ശേഷം നിങ്ങൾ മേടിക്കുന്ന സമ്മതപത്രമാണ് informed consent. ഈ രണ്ട് സാധനങ്ങളും ഇല്ലാതെ your case sheet is not perfect. Mind you, whenever you start your practice, right from day one, right from your patient one, you have to follow this, and it's better that you follow this. Now, regarding the case sheets, you saw the case sheets. How many years should you, keep it safe? Legally, they say it's 3 years, but I would say keep it for as long as you can, because ഒരു പേഷ്യന്റിന് ഒരു ഇൻസിഡന്റ് കഴിഞ്ഞ് കഴിഞ്ഞാൽ കോടതിയിൽ കൊണ്ട് കേസ് എടുക്കാൻ പറ്റുന്ന സമയം എന്ന് പറയുന്നത് generally 2 years ആണ്. But അതിന് ലീൻ ഉണ്ട്. When he goes to the court and says reasons or states reasons, court usually takes it up out of sympathy or out of humanitarian concern, especially consumer courts. Consumer courts, consumerന് വേണ്ടി നിലകൊള്ളുന്ന സ്ഥാപനങ്ങളായതുകൊണ്ട് they will definitely take it up. So it's better that you keep your case sheet safe for a long period, or that is the main thing. Period കേസുകളുടെ കാര്യത്തിൽ I don't know how many of you know this. Period patient mature ആകുന്ന വരെ ഈ കേസ് it's better that you hold it safe because mature ആയി കഴിഞ്ഞ പേഷ്യന്റിന് വേണമെങ്കിൽ നിങ്ങളെ അവന്റെ എന്തെങ്കിലും ഒരു കാര്യം ചെയ്ത് ശരിയായിരിക്കും അവർക്ക് കേസ് നിങ്ങൾക്കെതിരെ കേസ് ഫയൽ ചെയ്യാനുള്ള റൈറ്റ് ഉണ്ട്. So pediatricians and pediatricians, please be very careful. Stay medically safe. The second point, I said medical legally first, so that was regarding documentation and case sheets and consents, and then keeping them safe. Medically, nothing much to be said about it. You need to have such knowledge. You need to have workmanship or hand skills. You need to be knowing exactly what you're dealing with and what you're going to do. Because unlike the secure environments of your college or your department, where people are there to help you if something goes wrong, nobody is there to help you. It's you and your patient alone in private practice. So something goes wrong, you need to handle it yourself. And for that, because it's an ever-changing field, you need to update your knowledge frequently. That is where the importance of meets like this come on. Everything matters in private practice. Everything matters. ഒരു ആൾക്ക് നിങ്ങൾക്കെതിരെ പോയി കേസ് ഫയൽ ചെയ്യാൻ തോന്നുന്നതിന് ഒരു 100,000 കാരണങ്ങളാണ്. So make sure that every single point is taken care of. Your office setup, your personality, your work quality, your staff, your decision-making abilities, and the most important, common sense. Especially when it comes to your personality, your behavior, your communication skills, your confidence, and even the way you dress up. നമ്മളൊരു പേഷ്യന്റിനെ കാണുമ്പോൾ നമ്മൾക്ക് കോൺഫിഡൻസ് ഉണ്ടോ ഇല്ലയോ എന്നുള്ളത് പേഷ്യന്റ് ഈസിയായിട്ട് ചെയ്യാൻ പറ്റും. It is as simple as that. The same thing. There have been enough. കേസുകളുടെ കാര്യം പറഞ്ഞു തുടങ്ങിയാൽ that's the most interesting part, because it's just a 30-minute talk. അങ്ങനെ കേസുകളുടെ കാര്യം പറയാൻ പറ്റില്ല. But behavior ഒരു വലിയ റൂഡായിട്ട് നമ്മൾ ബിഹേവ് ചെയ്യുവോ അല്ലെങ്കിൽ നമ്മൾ കമ്മ്യൂണിക്കേറ്റ് ചെയ്യുന്നതിൽ ഒരു ഇച്ചിരി മോശമാവുകയോ ചെയ്താൽ that can easily lead up to a litigation. There have been instances. ചെരുപ്പ് പുറത്തൂരിയിടാൻ പറഞ്ഞതിന് കൊണ്ട് കേസ് കൊടുത്ത ഒരു പേഷ്യന്റ്. Can you believe that? കോവിഡ് ടൈമില് കൂടുതൽ പേഷ്യൻസിനെ നമ്മൾ ക്ലിനിക്കിനകത്ത് കയറ്റുന്ന ഒരു കാലഘട്ടമായിരുന്നില്ല. The minimum insight, that was what we were already practicing. ബൈസ്റ്റാൻഡർ കൂടെ കയറിയപ്പോൾ നിങ്ങൾ പുറത്ത് നിൽക്കാൻ പറഞ്ഞതിന് പേഷ്യന്റിനെ ഇൻസ്റ്റിഗേറ്റ് ചെയ്തുകൊണ്ട് കേസ് കൊടുത്തത് ഇപ്പൊ അതൊരു വലിയ കേസായിരിക്കും കേസ്. So all these things matters. Please understand that. Remain technically safe. The third point that I said. Never leave loopholes. നിങ്ങൾക്കൊരു റൂൾസും എടുക്കാൻ പറ്റില്ലായിരിക്കും. നിങ്ങൾക്കൊരു ഇൻസ്ട്രുമെന്റ് സെപ്പറേഷൻ ചിലപ്പോൾ റിട്രീവ് ചെയ്യാൻ പറ്റുന്നുണ്ടായിരിക്കില്ല. Let it be, whatever happens, be open, because confidentiality പോലെ തന്നെ patient rights എന്ന് പറയുന്ന ഒരു സംഗതി patient ഉണ്ട്. He needs to know what is being done on him, what was done on him. അവരുടെ റൈറ്റ്സിന്റെ വയലേഷൻ ആണ്. If you don't actually open up and tell them what happened, you left the instrument separate instrument, no problem. Let it be. Always you can't retrieve it. You can go and upgrade. But the thing is, you have to tell the patient openly such a thing happened. It's okay. You have to reassure him and then leave the instrument there. No problem. But again, I'm telling you, document it. When it goes to the court, everything should be in black and white. It should be written. History taking is one very, very crucial thing. There will be so many things hidden, which will come out if you take a proper history. പേഷ്യന്റ് ബ്ലൈൻഡ് ആയിട്ട് പോയിട്ട് കോടതിയിൽ പറയും, എന്നോട് ചോദിച്ചില്ല, ഞാൻ പറഞ്ഞില്ല. So you are supposed to ask. You are supposed to extract it from them. If you don't take a real good case history or a patient history, then there are enough and more instances that you land up with problems, because the patient, as you all know, might have so many systemic conditions underlying, which even they might not be knowing. That is your faith. That is your faith. You will have it. പിന്നെ ഇൻവെസ്റ്റിഗേഷൻസിന്റെ കേസിൽ ഡോക്ടർ ന്യാസിക്ക് ഇവിടെ പറഞ്ഞു CBCT കാര്യം. CBCT പോയിട്ട് ഒരു എക്സ്റേ പോലും ഇല്ലാതെ ഇംപ്ലാൻസ് ചെയ്തിട്ട് ഏറ്റവും വലിയ ക്ലെയിം വന്നിട്ടുള്ള ഒരു കേസ് ഇപ്പൊ നമ്മൾ ഫൈറ്റ് ചെയ്തിട്ടില്ല. Claim is over 1 crore and it is being fought. The doctor was actually partying. That is when he got the call from a patient. Patient said he saw the patient a few days ago, few days back. But the patient had mentioned actually he wanted to go to US and he had very little time. He was at a party, he was at a function. Patient വിളിച്ചു, ഡോക്ടർ ഞാൻ ഒരു 3-4 ദിവസം കഴിയുമ്പോൾ എന്റെ ടിക്കറ്റ് ആണ്. അപ്പൊ എനിക്ക് ആ പറഞ്ഞ ലോവർ മാൻഡിബിൾ ലോവർ സൈഡിൽ ഒരു 3 ഇംപ്ലാന്റ്സ് വെക്കാനുണ്ട്. നമ്മൾ സംസാരിച്ചായിരുന്നല്ലോ. അപ്പം അത് എങ്ങനെയാണെന്ന് വെച്ചാൽ ഇന്ന് മാത്രമേ ഞാൻ ഫ്രീ ഉള്ളൂ എന്ന് വരാവൂ എന്ന് ചോദിച്ചു. കേട്ട പാട് കേൾക്കാത്ത പാട് കൊള്ളാം 3 ഇംപ്ലാന്റ്സ്. ഓക്കെ, ഓവർ എ ലാക്ക്, സോ വൈ നോട്ട്? പാർട്ടിയുടെ അടുക്കുന്ന നേരെ വണ്ടിയിൽ കയറി. Ask the staff also to come, ask the patient to come. The patient, the doctor is very experienced. ഇഷ്ടം പോലെ കേസസ് ചെയ്തിട്ടുള്ള ഡോക്ടറാണ്. അപ്പം he just straight away went and started open up. ലാബ് റിഫ്ലക്ട് ചെയ്തപ്പോഴേക്കാണ് നേരിട്ട് കാണുന്ന പോലൊന്നുമല്ല. അണ്ടർലൈൻ ബോൺ വാസ് ഡിഫറെന്റ്. 5 ഏരിയയിൽ പ്രീമോളർ, സെക്കൻഡ് പ്രീമോളർ ഏരിയയിൽ ആദ്യം ഒരു ഓസ്റ്റോട്ടമി ചെയ്തു. ഇംപ്ലാന്റ് പ്ലേസ് ചെയ്തു. It was just floating. He never attained primary stability. അത് സാരമില്ല, ഒരെണ്ണമല്ലേ ഉള്ളൂ, ഇനിയും കിടക്കുന്നില്ല, സ്ഥലമുണ്ടല്ലോ. So he went for the second one. Second one, the bone was narrow. Somehow or other he managed to do osteotomy. അത് ഇംപ്ലാന്റ് പ്ലേസ് ചെയ്തപ്പോഴത്തേക്ക് got optically engaged. അത് അകത്തോട്ടും പോയില്ല, പുറത്തോട്ടും വരില്ല. So half the implant was outside. അപ്പോൾ പതുക്കെ panic settled and then he went to the third one. മൂന്നാമത്തെ ഇംപ്ലാന്റ് പോയപ്പോൾ എന്നാ സംഭവിച്ചു? Out of the panic of the other two, he just overshooted. Inferior canal's root, the roof of cortichon, it just plunged directly into the inferior nerve, severing the nerve. And do I have to tell you what happened next? For Mona, the X-ray is now taken, implanted, corrected, and the molar. So this kind of things happens when you don't actually take proper precautions and do not take actually treatment, do not make your treatment plan. ഓടി വന്ന് പെട്ടെന്ന് ഒരു കാര്യം ചെയ്യുക എന്ന് പറയുന്നത് is not a huge thing. So whenever you need to do an investigation, do it. Whenever you need to take action, please do take X-rays or PGs or CVCs or whatever. ഇങ്ങനെയൊക്കെ precautions എടുത്താലും do you think that problems won't occur? Definitely they will pop up. Whatever precautions you can take, you take, but still you can expect problems that might come up every now and then. And then is where you feel totally isolated and helpless. No one to look up to, no one to help you. ആ സമയം വരുമ്പോഴത്തേക്കും ആണ് നമ്മൾ ശരിക്കും ആലോചിക്കുന്നത്, ഇത് വേണമായിരുന്നു, ഇങ്ങനെ ചെയ്യണമായിരുന്നു, I should have documented. And this is the time when we get calls, distress calls from doctors. Doctor, ഞാൻ ഉണ്ടിട്ട് എത്ര ദിവസമായി, ഞാൻ കിടന്നുറങ്ങിയിട്ട് എത്ര ദിവസമായി, I can't work, I can't go to my clinic. He is totally shattered. നല്ലൊരു പ്രാക്ടീസ് ഉണ്ടായിരുന്നതാണ്, നന്നായിട്ട് ബിൽഡപ്പ് ചെയ്തതാണ്. പക്ഷെ ഇപ്പൊ ക്ലിനിക്ക് ചെല്ലുമ്പോഴത്തേക്കാണ് അവിടെ ആളുകൾ കാത്തിരിക്കുകയാണ്, അടിക്കാനും തല്ലാനും പോലാണ്. He can't go into his clinic. So such situation should never arise. But of course, it all depends on faith. How careful we are, these things might happen. Please don't be under the impression that all these things happen to only you beginners. No. All over Kerala, the length and breadth of Kerala, right from Kasaragod to Balashala, we are fighting cases. Numerous cases where doctors of all age groups are involved, maybe the senior most to maybe the junior most, plus doctors of all specialties are involved. Right now, we are fighting cases, 40-odd cases, all across the length and breadth of Kerala in different courts. പക്ഷേ ഈ 40 എന്ന് പറയുന്ന ഒരു നമ്പർ ആണെന്ന് നിങ്ങൾ വിചാരിക്കുന്നത്. 40 അല്ല, ആക്ച്വലി അതിന്റെ ഒരു 2-fold വരും ശരിക്കുള്ള നമ്പർ. Because we have a very neat and good setup where we can actually assess and counter cases, prepare replies, and actually reply notices that come up frequently. That means advocate notices that come up frequently. പല കേസുകളും അവിടെ കൊണ്ടങ്ങ് തീരുകയാണ്. അങ്ങനെ തീരുന്നതുകൊണ്ടാണ് the rest of the cases, the rest of the number is what you see as 40. The number would have been much more had we were not so organized and prompt in dealing with all of this. The compensation, you should be knowing that ഈ കേസിന്റെ compensation ranges from thousands to crores. I repeat, thousands to crores, not lakhs. Now, this is where actually a lot more of discussion needs to be done, and this is the most interesting part. But due to lack of time, now the case by case I can discuss here. But you should be knowing that all clinical specialties are important in litigations. അതിന് ഇന്നതൊന്നുമില്ല. Oral surgery കൂടുതൽ അല്ലെങ്കിൽ prosthodontics കൂടുതൽ, endodontics കൂടുതൽ, nothing like it. There are enough and more cases in each and every specialties, especially clinical specialties. Otherwise, I wouldn't be saying this. Oral surgery cases, there are so many, not so many, but I would say that deaths have occurred, and so many wrong extraction cases, loss of eyesight, paresthesia, trismus, face infections, whatnot. And likewise in prosthodontics, faulty dentures, aesthetic issues, not meeting expectations, ingestion of dentures. Mind you, there have been so many instances of dentures being ingested and complications occurring. And RCTs, as you all know, RCTs tend to fail at times. So RCT failures are a common happening. And periodontics, are there any periodontics sitting here? Any periodontics over here? In the recent times, we have had two perio cases where perio patients ingested files. And the case, the file went into the stomach. The patient was taken to another hospital and I was admitted there. The normal case, what happened, it was passed through. And in the second case, I still remember I was traveling to Bangalore. The call came up around 10:30. I was just slipping into my sleep, and that's when the call came. The patient was admitted in Palakad hospital. Actually, the file went into the lungs. The patient was in ICU, a small little girl, child. The periodontist, the parents, the branch members, his colleagues, all were there, and they were waiting for the pediatric surgeon to come and have a look at the patient. So after some time, when the pediatric surgeon came, he said, we will try 2 times to do bronchoscopy, and if it doesn't come out, we will have to do a thoracotomy and take out the file. Just imagine. Thoracotomy, you know what the surgery is. You have to cut open the rib cage, go to the lungs, and take out the instrument. The same incident, I remember the same incident happening long back, maybe in 2002 or 2004. I don't remember exactly when. I was a chief secretary that time. And at that time, I still remember thoracotomy was done in Kochi Medical College, and the file was taken out, and the settlement, doctor was not a member of any of the association or so-called group or anything. He had to settle the case for 10.5 lakhs or something. At that time, 2004 it will come in tunes of maybe a few more lakhs, 30-40 lakhs. But in the cases, they keep happening. These are not under our control. Safety measures, these things can happen. So we have to be careful about all this. Periodontics comparatively problem-free orthodontic cases, failure of orthodontic cases, mobility of teeth, and implant surgery, as I said, it's a very tricky thing. Implant cases, there have been a lot of cases that have been coming up. So these are the specialties involved. I wish I could actually discuss the cases with you because that's the most interesting part. But if I go on to specific cases, case after cases, then it will take a long time. Maybe it will take days together. But that is the most important and the most interesting part because അപ്പോഴാണ് നമുക്ക് എന്ത് പ്രിക്കോഷൻസ് എടുത്താൽ നമുക്ക് സേഫ് ആയിട്ട് ഒരുമാതിരി സേഫ് ആയിട്ടൊക്കെ പ്രാക്ടീസ് ചെയ്ത് പോകാം. Basically, the causes of cases, when we analyze, we find that most of the cases that we are fighting right now comes from the starts of the mouth of another colleague of ours, maybe another dentist or a doctor or a medical doctor. Okay, so it's nothing which we have had, nothing. Something which we all should refrain from. Then right from the time you start practicing, never do it. Because once you do it, remember, it will always come back to you in one way or other, and you will be hit at some point of time. Of course, all professionals ethically practice, unethically practice, and there are quite a few doctors who do some unethical practice and who do negligent work. So that is one reason, lack of diplomacy and improper communication. But if somehow ഉണ്ടായി കഴിഞ്ഞാൽ പിന്നെ നമ്മളെ പേഷ്യന്റിനോട് patient hearing കൊടുക്കുക എന്ന് പറയുന്നത് ബേസിക് കർച്ചയാണ്. അതുപോലും ചെയ്യാതെ അവരോട് റൂഡായിട്ട് പെരുമാറുകയും if you just അവരെ ക്ലിനിക്കിൽ നാട്ടി ഒഴിക്കുകയൊക്കെ ചെയ്ത് കഴിഞ്ഞാൽ you don't have to look anywhere else for a case coming up your way. And one another basic reason is overcharging. Dentistry is a very rewarding profession as it is. നമുക്ക് നല്ലൊരു മാർജിൻ കിട്ടുന്ന ഒരു പ്രൊഫഷൻ തന്നെയാണ്. You can make a decent earn. You don't have to really go and overcharge. ഒത്തിരി കേസുകളിലും നമ്മളിപ്പോ ഫൈറ്റ് ചെയ്യുന്ന കേസുകളിലും patient instigation to go on for a case is nothing but overcharge. പിന്നെ ക്ലിയർ കട്ടായിട്ട് എവിഡൻസ് ഉള്ള കേസുകൾ, that is nothing but negligence. I said earlier, we technically say never leave loopholes. Loopholes ഇട്ടിട്ട് വിട്ടാൽ വേറൊരു സ്ഥലത്ത് ചെല്ലുമ്പോൾ അവർക്ക് നിങ്ങളെ ഷീൽഡ് ചെയ്യണമെന്നുണ്ടെങ്കിൽ പോലും sometimes they may not be, because they might be having complications. Patient complication, root in the sinus, അത് ഇൻഫെക്റ്റഡ് ആയിട്ട് ചെയ്ത് സൈനസൈറ്റിസ് ആയിട്ട് ചെയ്യുന്ന ഭയങ്കര സിവിയർ ഇൻഫെക്ഷൻ ആയിട്ട് ചെയ്ത് കഴിഞ്ഞാൽ ഇത് കുഴപ്പമൊന്നും ഇല്ലാതെ പറഞ്ഞാൽ ആ കാണുന്ന ഡോക്ടർക്ക് വിടാൻ പറ്റും, ഓപ്പോസിറ്റിന് വിടാൻ പറ്റും. You will have to tell that. So that is your problem. Right? Once it happens, you refer them to the best possible place. Now, how will you know? I'm just running through because we have stipulated that. How will you know about cases? Cases it will come as a phone call from the patient, maybe a visit from the patient, a visit from a neighbor, from their relatives, or mobile, or certainly call site, police station, people go and file a case, file a complaint to the police station. They call you. But there is another advantage nowadays. Supreme Court has passed the proceedings earlier, which was happening earlier. When a complaint comes up, doctor arrest ചെയ്യുന്ന പരിപാടി. That is normal there. They have to actually call us, and then നമ്മുടെ സൈഡിലുള്ള കേട്ടിട്ടൊക്കെയുള്ള പരിപാടികളിലേക്ക് usually happens. So പോലീസ് സ്റ്റേഷനിൽ ഒരു കോൾ വരിക, അവിടെ ചെല്ലേണ്ടി വരിക, അവിടെ ചെല്ലുമ്പോൾ you might actually face a little bit of hostility and things like that. So always never go alone. Take a colleague or two of yours with you, or an advocate with you. അങ്ങനെ ഇങ്ങനത്തെ കാര്യങ്ങളാണ് എപ്പോഴും നമ്മൾ ഫോളോ ചെയ്യേണ്ട ചില കാര്യങ്ങൾ. പിന്നെ പാർട്ടി ഓഫീസുകളിൽ നിന്ന് പൊളിറ്റിക്കൽ ഇൻവോൾവ്മെന്റ്, അഡ്വക്കേറ്റ് ഓഫീസിൽ നിന്ന് ഒരു കോൾ ആയിട്ട്, അതുപോലെ തന്നെ അഡ്വക്കേറ്റിന്റെ നോട്ടീസ്, ദാറ്റ് ഇസ് ദ മോസ്റ്റ് കോമൺ തിങ്. നോട്ടീസ് ഒരു സുപ്രഭാതത്തിൽ നിങ്ങളുടെ ഒരു രജിസ്റ്റേർഡ് notice വരുന്നതാണ്. That is how a case comes up. Or it can even go a step further. Notice വരുന്നതിന് മുമ്പ് ചിലപ്പോൾ കോടതിയിൽ നിന്ന് ഒരു സമൻസ് തന്നെ ആയിരിക്കും. Because they simply don't bother to send a notice. Rather they go and straight to file a case. You must be thinking what this man is doing, coming in the morning and instantly fearing all of you. ഇതിനൊക്കെ വരെ പണിയൊന്നുമില്ല, രാവിലെ വന്നിട്ട് ഇങ്ങനെ ഈ ഡെന്റിസ്ട്രി ഭയങ്കര അങ്ങനെയാണ് പോയാണെന്ന് പറയുകയും ചെയ്യും. At the same time he's frightening us. No, yes, I'm just cautioning you, because you all are going to be practicing dentistry. So, കുറച്ച് പേരെങ്കിലും ഇവിടെ ഇരിക്കുന്നവർ 10-30 വർഷമായിട്ട് ഡെന്റിസ്ട്രി പ്രാക്ടീസ് ചെയ്യുന്നവർ. Lucky for us, വലിയ പ്രോബ്ലംസ് ഒന്നും ഇല്ലാതെ വേണ്ടി പോകുന്നു. നമ്മൾ ഈ പറഞ്ഞ പ്രോബ്ലംസിനെല്ലാം സൊല്യൂഷൻസും ഉണ്ട്. When you pass out, take your registration, then join IDA. I don't know how many of you know what IDA is. If you didn't, we don't know, please try to know about it. Be student IDA members and join IDA. And only after joining any of the local branches as an IDA member can you join HOPE. HOPE is a beautiful scheme of IDA Kerala State Branch. Its full form is nothing but help offered for professionals in emergency. എന്തെങ്കിലും തട്ടുകേടുകൾ ഇതുപോലെ വരുമ്പോൾ that is your priority. ഉണ്ടെങ്കിൽ വലിയ പ്രശ്നങ്ങളൊന്നും ഇല്ലാതെ നമുക്ക് കാര്യങ്ങളെ ഹാൻഡിൽ ചെയ്യാൻ സാധിക്കും. It's a very unique scheme of IDA Kerala State, perhaps the only one of its kind in India, where ഒരു സ്റ്റേറ്റിനും IDA HOPE പോലെ കേരള സ്റ്റേറ്റ് ബ്രാഞ്ചിന്റെ HOPE പോലെ ഒരു സ്കീം ഉണ്ടെന്ന് എനിക്ക് തോന്നുന്നില്ല. And it has been there functional right from 2007 onwards, serving all its members in different ways, not just giving professional indemnity, but giving them medical facilities, giving them general insurance facilities and things like that. Because we are talking about professional things, medical, legal things. ഈ ഹോപ്പിൽ നമുക്ക് മെഡിക്കൽ നമ്മുടെ ഇൻഡെമിനിറ്റി കവർ നമുക്ക് എടുക്കുന്നത് we can decide on how much we want. It starts right from 4 lakhs onwards and it goes up to 2 crores. So that is a recent induction. As for me, I think it is somewhere around 1 crore or something. നമ്മൾ അതിനനുസരിച്ചുള്ള പ്രീമിയം നമ്മൾ കൊടുക്കുകയാണെങ്കിൽ നമുക്ക് ആ ഒരു കവറേജ് നമുക്ക് കിട്ടും. So that is how it works. It's a beautiful scheme. The benefits are usually the desired range of indemnity that you decide, saving a lot of your time, practice and professional time, because ഒരു കേസ് വന്നു കഴിഞ്ഞാൽ 2007 കേസുകളൊക്കെ ഇപ്പോഴും ലൈവാണ്. 2007 കേസുകൾ ഇപ്പോഴും തീരുമാനമായിട്ടില്ല. അപ്പൊ just imagine it goes on for years and years. You will be called to the court time and again. You will be called to the police station. You will be wasting a lot of your practice time. മനസ്സമാധാനം എല്ലാം പോകും. Instead, just after when you get an admitting notice or something, just give a call to the HOPE office. The concerned people of HOPE, they will come to your service and then they will help you out in handling the case. Right from fabricating a beautiful reply notice to the notice that was served to you, till the court proceedings, till the end of the case. The highlights of HOPE, when you actually number it, there are many. But the main thing is that ഇത് പറയുമ്പോൾ ഇവിടെ കുറച്ചു പേരെങ്കിലും എന്നെ എതിർക്കാൻ കാണും. HOPE has not lost a single case even now. എന്ന് പറയുമ്പോൾ കുറച്ചു പേരെങ്കിലും ഇവിടെ ചോദിച്ചു, കുറച്ച് നാൾ മുമ്പ് നിങ്ങളെ ഇങ്ങനെ കീറിയിട്ട് ഡീറ്റെയിൽ ഒട്ടിക്കുന്നത് നിങ്ങൾ കണ്ടായിരുന്നല്ലോ, കേസുകളൊക്കെ തോറ്റത് കണ്ടായിരുന്നല്ലോ. I am talking about cases that we have, not talking about cases that we have lost in the lower court. Consumer forums എന്ന് പറയുന്നത് കൺസ്യൂമേഴ്സിന് വേണ്ടി വെച്ചിരിക്കുന്നതാണ്. District consumer forums we have lost cases, enough or more cases. But again, let me tell you, that's because of sheer lack of documentation, sheer lack of defense that we have. Patient illa, documents illa, ഒന്നുമില്ല. പിന്നെ എങ്ങനെ നമ്മൾ ഒരു കേസ് കൊണ്ടുപോയി നമ്മൾ അവിടെ പ്രസന്റ് ചെയ്യും? അങ്ങനെ നമ്മൾ കുറച്ച് കേസുകൾ നമ്മൾ ലോവർ കോർട്ടിൽ ലൂസ് ചെയ്തിട്ടുണ്ടെങ്കിൽ പോലും when we go to the higher courts, in the state commission or in the higher courts, we have never lost a case. So the track record is 100% so far all these years. It has got a beautiful, efficient network of advocates and doctors who actually sit together and fabricate the reply notices and things like that. Other than for them, the cases would have been much, much more. In case of a loss in the sense that a case from a losing you don't have to pay a fine. Personal protection scheme or rather HOPE, as it is called now, will pay your money. And apart from the indemnity covers that we have, there are a lot of other benefits that I'm not going through. I'm going to it. There are medical benefits, there are general insurance benefits, and things like that. So please do remember that solutions to all these problems that we discussed earlier can be made by joining HOPE, joining IDA, being a member of IDA. Okay? Let me not exceed my time because we were running really short of time. As I said earlier, the path you have chosen is right. just know about the hidden dangers here and there so that you can take all precautions and be alert. The future is definitely bright. I wish you all a very bright future. And provided you handle it very carefully, wishing you all a very enjoyable academic year as well as a peaceful and successful